And when we work with patients of different cultures, it gives us the opportunity to have critical moments of insight because we're able to play in their world that we can't just treat with pills and drugs, that we have to understand, well understand, the patient's life world before they got ill, before they had pain, in order to access what we call in trauma work their resources. And by resourcing in the moment with patients, in the moment with their music, we actually get a feeling for what made them well. And that allows special access to prescribed music and also to influence the treatment plans doctors and nurses might make. One of the things we've had the privilege to grow as part of our methodology at the Louis Armstrong Center is this idea of musical sedation. So at times people like to put on soft music to help them sleep. That may be effective, but if the rhythm and meter doesn't change, it's not going to enable a sleep response as quickly as our sleep sedation model, which is taking a song that a patient, or a piece of music, that a patient may bring in, that they say relaxes them. So we start with what they know, what's familiar. Then we take away the words, because words are all cognitive. And so we want to make these steps to sedate as simple as possible. So after we take away the words, we'll put a vowel or phoneme. A phoneme is part of a word that has a vowel in it, and we adapt it to the body's ailment. So if someone has asthma or chronic obstructive pulmonary disease, the vowel is ah. If someone has brain abnormalities or vision problem or hearing, we'll use the syllable E, and so forth. Then we change the meter of the song to what we call a holding meter. A holding meter is a 3/4 or a 6/8. It has a lull. A lull, it's a great onomatopoeic word, has this sforzando diminuendo. So then the 3/4, 6/8 meter is done for a while, and we watch the patient. Then when it looks like they're getting sleepier, we will take the cadence of the tune and just repeat the last two measures, or the last measure. And we call this the cadential effect. That's when you have like the amen of a prayer, and you just repeat it over and over again. And then you take the very last note. That's what we call the tonic in music, and you entrain with the patient's breathing so that it's just one note. So here we've described musical sedation, which is much more effective, much safer, and has been evidence-based. It's research proved that we start with what the patient brings in and really bear down to one note. And this is something we use for infants. This is something we use particularly for patients at the end of life, because people, when they know they're dying, or even if they don't know they're dying, they become very agitated and sleepless. So if you can be in the moment with someone who's having palliative care but is scared to miss that exact moment of transition from wake to sleep, this sedation, musical sedation, can be very effective. And we all use it, and we've published it, and it's wonderful to be able to use music as a resource in music therapy.